Good evening, everyone. It's a video on acute ischemic stroke and Tenecteplase and Alteplase dosing. It's a video mainly for the healthcare professionals, but it will also help ordinary people because we know stroke is a medical emergency. Early treatment is needed for the patient. So, any knowledge that anybody can acquire for stroke or stroke treatment will be beneficial for quick treatment for a patient. So I'm making this video mainly to highlight the dosing of tenecteplase and alteplase for acute ischemic stroke. So stroke, which we know as a layman's term, in medical term is CVA or cardiovascular accident, and stroke can be two different types: hemorrhagic stroke or ischemic stroke. Even though both are stroke, but it's actually totally different scenario. In hemorrhagic stroke, you have a bleeding into the brain, which is causing bleeding into a part of a brain, and that can be either intercerebral hemorrhage when it's called ICH, or subarachnoid hemorrhage or SAH. And when you have bleeding and hemorrhagic stroke, then medicines like Casentra, Fiva, Andexa, PCC, FFP, vitamin K, Praxbind, this type of medicines are needed to stop the bleeding for hemorrhagic stroke, and physicians determines which medicine will be needed based on what's the patient condition, what anticoagulant patient was eating, and many other different scenarios like that. But for today's purpose, the acute ischemic stroke is a clot that is resulting in a decreased blood flow to a part of the brain. So we have to use a thrombolytic agent to break that clot. And the two thrombolytic agent that is used for that purpose is either tenecteplase or alteplase. Both can be used, and different facilities carry different tons. So for the purpose of dosing tenecteplase, which is also known as TNKs, the dose is 0.25 milligram per kg, and there is a maximum cap, maximum dose limit of 25 milligram, and that dose is administered as an IV bolus over 5 seconds. So that's the dose for tenecteplase for acute ischemic stroke. And if someone wants to use alteplase, and the brand name is Activase, the dose is 0.9 milligram per kg, and again there's a maximum cap, maximum dose limit of 90 milligram. So if someone uses a 100 milligram vial, normally it comes either 50 or 100 milligram vial. So if someone uses a 100 milligram vial, there will be always a 10 milligram extra dose in that vial, because the maximum dose is 90. You cannot go more than that. So out of that dose that someone will calculate, 0.9 milligram per kg for a patient, 10% of that dose is given as IV bolus over 1 minute, and then the remaining 90% is given as a continuous IV infusion over 1 hour. This is a very basic about tenecteplase and alteplase dosing, and it's very vital information, because if enough healthcare workers and students know this thing, then stroke patients, when they come to any facility, it will be in the worldwide, it will be very easy or quick to be given to the patient to calculate the dose. Here you can see that acute ischemic stroke is because of a clot in the brain, and the signs and symptoms of stroke are facial droop, weakness or numbness in arm, difficulty speaking, confusion, poor balance, or loss of vision. It's important to know these symptoms of stroke, and the risk factors for stroke can be high blood pressure, history of transient ischemic attack TIA, cigarette smoking, high cholesterol, diabetes, or obesity. Tenecteplase has some exclusion criteria, meaning there are some conditions when it cannot be used for a patient, and those exclusion criteria are current intracranial hemorrhage, subarachnoid hemorrhage, active internal bleeding, recent within 3 months, intracranial or interspinal surgery or serious head trauma, presence of intracranial conditions that may increase the risk of bleeding, platelet count less than 100,000, current using of an anticoagulant with an INR greater than 1.7, and current severe uncontrolled hypertension, which is systolic blood pressure greater than 185 or diastolic blood pressure greater than 110. In these scenarios, Tenecteplase cannot be used for a patient for acute ischemic stroke. Tenecteplase comes as a kit from the manufacturer, and the kit contains the vial for Tenecteplase powder, the 10 ml syringe, and a 10 ml vial of sterile water, and it is mixed as 5 mg per ml final concentration by the sterile water that is supplied in the kit. And it is to remember that Tenecteplase is not compatible with dextrose containing fluids, so flush line with normal saline before and after the injection. And here you can see the patient dose based on 0.25 mg per kg. What will be the Tenecteplase dose based on a patient weight? And the mixing of Tenecteplase is very easy for administration. If you have a 50 mg vial of Tenecteplase, you add 10 ml of sterile water into the vial to make it 5 mg per ml concentration. You don't shake the vial, you just gently swirl the vial to mix it, and from that vial you just draw the required volume based on the patient dose. Whatever ml the patient dose is, you draw out from that vial of Tenecteplase, and that dose is administered over 5 seconds as an IV bolus. And remember, the maximum dose is 25 mg for acute ischemic stroke. And if your facility or hospital carries a different milligram size of Tenecteplase vial, you mix that vial according to the instruction that is given into the kit. Alteplase also has some exclusion criteria or contraindications, just like Tenecteplase, and some of those would be clinical presentation of a subarachnoid hemorrhage or intracranial hemorrhage, history of aneurysm, AVM or intracranial neoplasm, history of head trauma within past 3 months, seizure at onset of stroke, previous stroke within past 3 months, current use of anticoagulant and INR greater than 1.7, platelet count less than 100,000, blood glucose less than 50 or greater than 400, surgery within past 14 days, and some others. You can see the whole list from the protocol over here. Alteplase also comes as a kit from the manufacturer with sterile water for injection. And here is a protocol for Alteplase for acute ischemic stroke for a hospital. You can see the protocol has options for ordering nitroglycerin paste or labetalol IV injection for the patient. And the dose for Alteplase you can see here 0.9 mg per kg body weight, and 10% of that dose is given over 1 minute as IV bolus, and the remaining 90% is given over 60 minutes via pump. And the protocol also has options for nicardipine or cardin drip ordering, because patients may need that for blood pressure control. So these are some valuable information regarding Tenecteplase and Alteplase for acute ischemic stroke patients. I hope you will find the video valuable, and please subscribe to the channel. I hope to see you guys again next time. Thank you.